Hi everyone and welcome to Vax Talks. I'm Brad Satin, joined today by Dr. Sina Bavari. He is the Chief Science Officer at Helion Bio, also the former Science Director at the U.S. Army Medical Research Institute of Infectious Diseases. Thanks so much for joining us today.
My pleasure being here.
Well, you know, because of COVID-19, of course, there's a lot of talk right now about vaccines. And today we want to talk about MRC5 cells. Can you tell us what they are?
MRC5s are obtained almost 60 years ago from fetal tissues and have been used to generate some vaccines or to do some preliminary work on some vaccines.
And what is all the controversy about?
Well, since they become from aborted fetuses, there are a lot of discussions about, is this feasible, ethical? Is it valid to use these type of cells in general? Besides MRC5, there are other cells that have been used also for developing vaccines.
So are any of the vaccines in the news today, the big ones, using these MRC5 cells?
Not to my knowledge, absolutely not to my knowledge. Now, beside this, fetal tissues have been used in biomedical research since 1930s. And they actually play a critical role in advancing medical science due to many unique properties that fetal tissues and cells have, and that adult cells just don't have. For this reason, this actually allows these cells to be very unique and in a way that they can actually perpetuate, for example, a virus that adult cells can't. So this is why in some cases, in some vaccines, fetal cells have been used to develop vaccines, such as measles vaccines, for example, rubella vaccines, and hepatitis A vaccines. They have used fetal cells and tissues to actually develop and expand their vaccines in it. So have fetal cells been used in development of vaccines? The answer is yes. And is MRC5 currently being used in current vaccines for SARS coronaviruses? The answer is absolutely not.
Well, thanks so much for kind of setting the record straight, answering some questions about these cells. We appreciate your time, Dr. Bavari.
Absolutely, my pleasure.
And thank you for joining us today for this edition of Vax Talks. I'm Brad Satin.